and they may have pain in a lower lumbar because they're just sitting on those passive structures. But also they may have a lot of muscle tone in rectus abdominis because if your diaphragm is posterior this way, so these muscles work extra hard, isn't it? If your abdominal is not going to work, you're going to fall over. So they work extra hard, and sometimes what happens, they almost constrict, they're getting a lot of stiffness or that core contraction through the rib cage. So if you've got a lot of core contraction through the rib cage, you're also going to put stress on the thoracic spine. So it could be thoracic kyphosis, not a fixed deformity, but it's just how they are, but also increased lumbar movement at that L5S1 typically, okay? And their weight is through more the heels. So this you can ask them, just ask them, where do you feel your weight through your feet, you feel? And they typically say on the heels, so you can even by shifting the weight on the toes, you automatically will increase the tone in your lumbar spinal muscles, isn't it? But in terms of a flexion, when they flex, they tend to use more lumbar and their lack of hips. But again, not always. We observe and we'll see how we move, okay? So in a way, the presentation for flexion and sway back, they're both going to have weakness in a lumbar extensors typically. So maybe you'd be a patient because you had a bit of, because you asked me a question, what's my pattern? And we looked at it and said, can we take your shoes off for me? And then just, so just flex your spine how you normally flex. Okay. So you can see what his strategy is. Very different to you, isn't it? So you go, sorry, come back up just to show to our participants. So both of you, so maybe you can stand there next to it, yeah. And you do your normal thing, not how I taught you. So you go, both of you. Can you see? So this is curved, thoracic, and range of lumbar. She's more flat, sort of more extended, isn't it? So she's got hip strategy. He's got more lumbar and thoracic. Both can be painful, both can be asymptomatic. So, but if asymptomatic, thank you. So you can see different ways of people moving. So want to know what are the contributing factors. So if you had a painful arc as you're flexing forward, so what my aim is, what should I do to change that? What do you think would help for you, for him? What's your name, sorry? FS. So what would be beneficial for FS if it was flexion pain, when he big swings from the floor or whatever? That's right, so with one maybe a bit more extension, what else? And a bit more hip flexion. So one of the retraining ways I could, so we can start in sitting even, so if you could sit for me please. So your feet are on the floor, yeah, good. And now I can place the little stick behind the patient's back. And you know what, and if he, all you do, you'd be very gentle, subtle, very friendly, but I say, listen, if you flex your back one more time, I'm joking. You don't do that. You don't do that. But you just want them. You're not a nice therapist. So what you want them to do, you want them to flex through the hips, you see? So now that helps in terms of motor control to utilize the hips. So flex through hips and lessen the lumbar. Can you see that, guys? Yeah? So from the side, perfect, so that's great. So we want, and when he keeps the spine in a bit of extension, your erector spine works better. Your multifidus works better. So for these people, they typically, even for sway back or even flexion pattern, they're going to have some weakness in the lumbar spine. So it's not always going to be overreactive. It can be weak as well. Good. And now the same thing I get you to do from sitting, standing, stand up, squat. No, yeah, the same way, yeah. Yeah, and come back up. Good. And as you're sitting down, you're flexing through the hips. I normally don't do that. I just feel a bit naughty this afternoon. Okay, and again, and squatting back down, so you're flexing through the hips. Lovely. Okay, so that could be one of your retraining patterns. Sometimes what you could do, other way, is like a waiters bow, you know, when the waiters in France bowing, or some, you know, when they sit in the five-star restaurants. So you could place sort of a stick behind. You can again stick the butt out, and the same thing you can do. It's like a waiter's bow, so you can teach them that way. So that's also, it's like a deadlift, isn't it? Oops. It's like a deadlift this way. So you want that for these people. You want them to utilize the hips, so hip strategy, and wear quad extensors. Okay? Squatting, the same. So I would use the stick a little bit. And can I get you to squat for me, please? No, you're there, sorry, yeah, sorry. I just back in where you want place. Okay, and then get them to squat a bit. Squat, back up. Just simple exercise like that. Okay. You can squat, and then after squatting, lift your hip up. So, like meaning, like, you know, squat and lift one leg up. Hold, and again, squat again, and lift the other leg up. Or you can change, yeah? Right to left. Now, especially guys, this for sway back. Remember what I said? If you were to sway back, so your acromion is posterior to greater trochanter, yeah? And then what happens? You get lengthening in your hip flexors. So for the sway back, typically, they may have weakness in the hip flexors because they are in a lengthened position. And at times they can have hip pain because you're just jamming a femoral head into your capsule. So this could be good for sway back, also work the hip flexors. So by even, again, yeah, do it again one more time, good. And lifting up, nice. And then down. And back up. So that could be one of the exercises as well. You could get them to kind of from, I don't know what's behind me. Good, so from kneeling position, what I get you to do, again, just watch first. So from pushing through a heel, come up, and then kneel again. Okay, so using legs, muscles, also hip flexors, and pushing up and hold, and again, lunge, and push up, hold. So you're just giving a bit more retraining in terms of motor control, and then vice versa on the side as well. Okay. The other things what you could do, so get you to, that's a bit more challenging. So this can be a starting point, just simple basic exercises. Now get you to sit on the floor facing that way. You know what, guys, I think we need more space because we're going to do some more stuff across there. So if you would come into maybe here and then squat again. So some other things I'll show you. So it's squat, sit on your butt facing the audience. Facing the audience and come back towards me a bit more. Good. Now, bend your knees for me and lift your arms up, all the way up. So when the patient does that, that also he needs to work his extensors. Hip flexors are also working, huh? So place your feet a bit wider, shoulder width apart, shoulder width. Now can you roll your knees? Yeah, good, to one side, good. And then come back. So he has to maintain the trunk upright, which will really, your lumbar muscles have to work very hard. Your core will work. So that could be another way of retraining this a bit for hip mobility, but also activation of the whole lumbar pelvic region. Now from here, I get you to come on your knees and come up, hold that. So in that position, stay there. Relax your foot there, that way. Okay. So stay there. Come up, good. Your glutes are working. Your lumbar paraspinal is working. Then you're sitting back down. Good. Change position and come up, hold. Glutes working, lumbar working quite nicely as well. And a few more times by yourself. Good. And up. sorry, yeah. Okay, good, and come up all the way up, hold that. Now, one more time, roll, good, turn, come up, hold that position. Now, step forward and with this leg, push up and stand up tall, lift your leg up. We need a bit more space. So but that could be almost that combined less, and then from there, I get you to come down, sit on the butt, roll, and other side. Okay? So all the way. Now bring this leg back. I think that was a bit different, but that's okay. Good. Step forward, push up, hold, hold, hold. Glutes are working, hip flexors are working, erector spine. So it's a combined exercise, isn't it? And again, bring this leg back and down. Yeah, good. Relax your foot and sit. Good. Roll, take your time. Push up. Perfect patient. Executing exercise very well. And hold that, and hold that. And again, a few more times again. Coming back down again. Could have been flipping that other way. That's okay. Push up, lift, and hold, and hold. Now this leg goes back down first. Down, yes. Sit so on your butt a bit. Okay, good. Push up, hold, and lift. So for this, we've got low tone, isn't it? So we want to increase the tone. But initially we would start with sort of basic stuff, you know, with a stick, that kind of thing. Once that improves. Now, other thing is what you could do if you want to, a little bit, you know, let's do the sway back, pretend that you've got a sway back. Yeah, so you've got a lot of kind of like a rectus abdominis tone maybe. Low abdominal wall might be weak, okay? And he sort of might even have the apical breathing pattern. If that's the case, we want more the ribs, the movement coming. Inhale in the rib cage, expand your belly. When it expands the belly, diaphragm descends, pelvic floor goes up. Okay, and again, breathe in from into the rib cage. As a proprioceptive feedback, what we could do, we could put TheraBand. And you must have done it already maybe for some people. Okay, and you get them to, now, again, get a stick and squat for me, so feet are shoulder width apart. Good, and hold, squat, and stay there. And breathe at the same time, into there. Good. So you're working your legs strongly, you're working your extensor strongly, you're also descending the diaphragm, relaxing through this upper chest a bit more. Then you can do dynamically, if you like, as well. Also, if you want a bit more cardiovascular work, so he's reducing the tone, put on a bike. On a bike with a band, get him to breathe faster in the lower part of the rib cage, working cardiovascular, increasing endorphins. All those things were benefits from exercise as well. So it's a variety of ways we can retrain that. Now in the office, you can ask the patient, maybe sit on the ball, not on the comfortable chair or office chair, so a bit more unstable environment, so that also helps to, you know, not to be in this passive sort of positions. So maybe bigger ball or some, whatever, you know, it can be. So just be creative and think about how can we increase muscle activity. But for like I said, deadlift's perfect exercise. All this stuff, you know, whatever you do, you know, you can do, you know, so all the gym stuff you can do as well. Depending on the age of the patient, what they need, what's the end goal as well. All right, any guys questions on that? Okay, so let's try with a stick, some balls, TheraBands, and try this. I know you need a bit more space, but you know, one at a time to try to do this combined movement. It's interesting, and look at the balance, look at, you know, how difficult that is for you.